Let me introduce Courtney. I'm very excited because Courtney has actually done some volunteer work for us in the past. She's written some articles that are on the website, and you can look for those by searching for her name. Okay, Courtney is a registered nurse, mental health advocate, and NLP practitioner. She is the founder of the Wellness Hive, a platform for living well. Courtney's background includes experience in sleep medicine, about 5 years of that, cognitive behavior therapy, mental health, and health education. She believes that there is no one-size approach to wellness and believes in the importance of utilizing a holistic approach to health promotion and illness prevention. She's skilled in health promotion, education, and illness prevention. She has been featured in Thrive Global, Goldcast, and now the Calgary Neuropathy Association. So I'm going to pass it over to Courtney, and Courtney is going to give her presentation.
Thank you. So as she said, I am Courtney. Today we're going to really be talking about sleep hygiene as it relates to pain. So I'm just going to share my screen. I'm going to present. Do you still see my screen? Okay. So mainly the topics of this presentation include insomnia and the impact on health, the link between pain and sleep, pain management, sleep hygiene, which includes tips for relaxation, and then some sleep cognitive reframes. Oops. So a little bit more about me. So I am a Calgary born, I'm a Starbucks addict. If you know me, I love my Starbucks chai lattes and can't live without them. And I'm always daydreaming of my next beach vacation, especially when we have gloomy days in Calgary like today. I am a registered nurse, so I'm currently working on the COVID contact tracing team, and I have about 5 years of sleep medicine experience, primarily in sleep apnea and insomnia. I also have prior experience as a behavioral sleep consultant, providing cognitive behavioral therapy for insomnia, and that's a little bit of what we're going to be discussing today. And then I'm also certified in epidemiology, peer recovery, NLP, so that's neuro-linguistic therapy, and emotional freedom technique, as well as mindset coaching. And then when I'm not doing healthcare work, you could also find me on social media. I'm a visibility and mindset coach, as well as social media strategist for wellpreneurs. Just a little about me. Okay, so I want you to ask yourself, on a scale of 1 to 10, how is your sleep currently? And there's really no right or wrong answer to this. Just kind of think about it. If you're able to comment on the chat box, you could comment as well. I don't have access. It looks like I can't see the chat box. I don't know what your answers are, but it's more kind of for personal reflection. Let me see if I can see the chat. Okay, so 10. And a 7, okay. And what are some sleep concerns that you're having? So what do you think is your biggest sort of sleep issues? Would you say it's more falling asleep? Is it poor quality of sleep, staying asleep? What's sort of bothering you right now? Okay, so poorly depending on the pain, wake up 3 times during night with neuropathy, okay. So today we'll mainly be talking about insomnia. So insomnia is the most prevalent sleep disorder, with about 48% of the population reporting some sort of sleep disturbance. And it's characterized by the perceived difficulty of initiating sleep, so falling asleep, or difficulty kind of staying asleep. And this usually lasts for at least about a month. So sometimes it could be more acute and more short term, depending on the circumstances. But when it starts to last more than a month, that's usually when it's considered insomnia. And there's actually been an increase in the prevalence of insomnia, so about 42% over the last, this study was done an 8-year period from 2007 to 2015 among Canadians aged 18 or over. Now imagine, because of COVID and a lot of stress among today's population, I imagine that's quite higher now. So we're steadily seeing insomnia increase over time. So sleep loss affects your health. So studies suggest that sleep loss has a wide range of health effects. So these things include diabetes, impaired glucose intolerance, cardiovascular disease and hypertension. Oops. Anxiety and depression, and increased inflammation and weakened immune response. And then as it relates to neuropathy, there's an increased sensitivity to pain. Now saying this, just because you do have sleep difficulties does not necessarily mean that there'll be a guarantee you develop these sort of health issues, but it's important to recognize that sleep is a part of your overall health and well-being, so it's kind of making sure that you're keeping on top of that. So sleep and pain. So research indicates that as pain intensifies or gets worse, sleep also gets worse. And as sleep gets worse, pain intensifies. So it's sort of like a vicious cycle where an individual's pain can create a poor night's sleep. And then that poor night's sleep may increase the intensity of pain felt the following day. So this is due to a lot of kind of biological factors in play. Studies have shown that sleep and pain tend to share a sort of similar pathway, and more research indicate the link between the two. So this is sort of the cycle I was speaking of. So chronic pain, it creates difficulty falling asleep and staying asleep, which leads to delayed healing. It increases inflammation, which could lead to more chronic pain, which again leads to more difficult sleeping, and it kind of just continues this cycle. So who can relate? If you just want to drop yes or no in the chat box, if you feel like you could relate to this. I'm sure many of you can. Let me see. Okay, a few yeses, yeah. Yeah, so it's quite common. So by knowing this, when managing pain and sleep disturbances, it's really important to manage both the pain and sleep rather than taking an individual approach. So being on top and managing both of them. So to manage the pain, so I always recommend that you discuss any sort of pain management with your doctor, and that would be taking the best individual approach, because obviously I don't know each of yours individual needs and medical history, but things that are options include medication, hot or cold therapy, physiotherapy, acupuncture, and diet, among a few others. But again, making sure that you discuss with your doctor the best approach to your pain management. And focusing on pain management is really critical to preventing insomnia, because if your pain keeps you awake and really prevents your sleep from being a quality good night's sleep, it's a high likely chance that insomnia can develop. So one resource available, I previously did a blog post for the Calgary Neuropathy Association, is the use of a pain journal. So a pain journal could be really helpful for you if you're wanting to kind of better understand your pain, kind of keeping track of what improves it, what makes it worse, and just kind of keeping an eye on how you could best manage it. And again, if you look up my name on the Calgary Neuropathy Association as well, I'll give these slides after, and you can find the link there to the journal. So ways to improve your sleep. So some helpful strategies to improve sleep include, we'll go over these in a little bit more detail, but just as an overview, stimulus control therapy, sleep compression, sleep hygiene, relaxation, and cognitive reframing. So these are the techniques we're going to go over. So stimulus control therapy, so it uses techniques to reduce the arousal and improve the positive association between bed and sleep. So pretty much you want your bedroom to be cued in your brain for your brain to associate your bedroom for sleep. So it's important to have this cue just to kind of make sure that if you're laying in bed and you're not falling asleep, you don't kind of cue your bedroom for wakefulness. So making sure that your bed and bedroom are for sleep and intimacy only. And then one way to improve stimulus control is to making sure that you are, if you're unable to sleep, so if you have those poor nights of sleep, or maybe your pain is just getting unmanageable and you don't think you're going to be able to fall asleep, I recommend you trying to leave your bedroom, maybe sit on a comfy couch in another room or elsewhere, just to try to make sure that you're limiting the bedroom for primarily sleep. Um, as well, because we don't want you laying in bed frustrated, because this could create hyperarousal, which will keep you awake as well. So sleep compression. So this is a technique I definitely advise you discussing with your doctor if you're going to apply it. But basically it's an approach that focuses on increasing the amount of good sleep and reducing any sort of delayed sleep onset, so difficulty falling asleep or any nighttime awakenings. So sleep efficiency is improved by compressing the total time in bed so that it matches your individual total sleep needs. So if it takes you about, I've seen some people about kind of 2 hours plus to fall asleep, and they're laying in bed for a total of 8 hours. So maybe they only need about actually 6 hours of sleep. So sleep is very individual, so we all need different amounts of times. It could range from 6 hours to 10 hours. It's really individual, so it's not like we all need for sure 8 hours. So really kind of reflecting on how much sleep you actually need and limiting it to that amount. And by staying up a little bit later, it also increases your sleep deprivation, which increases your sleep drive to increase your overall sleep quality and efficiency. And this technique is temporary. So once your sleep begins to improve and become more solid, your sleep window can gradually become increased until sleep needs are met. So basically this approach is kind of compressing your sleep window to kind of more solidify the sleep. So if you have maybe 8 hours of fragmented sleep, you kind of decrease it a little bit so it's more solid sleep. And then once it becomes more solid, then you can slowly increase it again. So again, please consult your doctor or sleep specialist prior to restricting your sleep any less than 7 hours, because some people have a greater sleep need than others. So it's important to be aware of that. So sleep hygiene. So sleep hygiene involves implementing behavioral lifestyle changes to help create a more stable sleep routine. So this is sort of one of my favorite areas of sleep health, is the sleep hygiene aspects. And some of these you'll likely already be familiar with. So things like regular physical activity. So again, discuss with your doctor on what's appropriate for you. Keeping a routine bedtime and rise time. So if you trying to maintain the same bedtime and wake time every day. So for myself, I tend to go to bed around 10 o'clock. Maybe on the weekends, I'll stay up a little bit later around maybe 11, but always sort of keeping it consistent. And then sleep only when sleepy. So if you're not sleepy, it's best to sort of stay awake, stay out of your bedroom to kind of keep that bedroom cue relationship, and only going to bed when you think you're actually going to fall asleep. And again, leave the bedroom if you're unable to fall asleep within 30 minutes. So if you tend to be kind of tossing and turning in bed, the best approach would be to leave your bedroom, maybe do something a little bit more relaxing, maybe do a puzzle or read a book, and then go back to bed when you're a little bit more tired. Avoid caffeine and nicotine for about 4 to 6 hours before bed, just because they're both kind of hyper arousing, so they could prevent your ability to fall asleep and disrupt the quality of sleep as well. And just be aware that in terms of caffeine, people could be more sensitive to caffeine than others. I know for myself, I have to limit my caffeine. I can't have caffeine no later than 10 a.m. because I'm sensitive. So if I have it later, I know it'll affect my bedtime. So just kind of being aware of it. Some people could have a cup of coffee right before bed and will be fine. So it's kind of a personal kind of thing. Use bedroom for sleep and intimacy only. So this was sort of what I was mentioning with the cueing of the bedroom for sleep. And limit napping, because the more naps that you have in the day, the more likely you'll have a disrupted quality of sleep. And again, this is sort of personal. So some people have certain health conditions that they may require additional naps and additional sleep. So kind of take it on a base by base. And then develop a pre-sleep routine. So this is sort of a routine that you could do just to kind of get you in the mindset of getting ready for bed. So doing things that kind of wind you down, relaxing, limiting any kind of hyper arousing activities, like I would avoid any sort of exercise or anything like that before bed. Instead, doing like things like maybe having a hot bath, reading a book, just kind of developing some sort of routine that helps you wind down and relax before bed. And this one tends to be a common one for people who struggle with insomnia. So avoid nighttime clock watching. So if you have a clock in the bedroom and you keep checking the clock every time you wake up in the middle of the night, it's likely not doing you any good. It's likely kind of making you more stressed and hyper aroused, which will decrease the likelihood of you being able to fall back asleep. So if that's the case, it's best to kind of turn your clock away or not even have it in the room. I know some people use it for alarm, but just kind of turning it to the side so that doesn't become an issue for you. Avoid heavy snacking before bed. So when we eat any sort of large food before bedtime, it activates our digestive system, and that digestive system is kind of it activates our kind of wakefulness. So when we go to bed, we want it to be resting. We don't want our digestive system to be active, because when it's active, it cues our brain signaling it's wakefulness time. Now, unless you have something like diabetes or anything like that, you may need that bedtime snack. But if you're able to, it's best to limit any kind of heavy snacking. This one, so create a quiet and comfortable sleep environment. So try to limit any kind of noises. So some people, if they live in a noisy neighborhood, you may want to consider kind of some sort of ear plugs while you sleep, making sure that your bedroom is dark, you don't have any sort of outside lights, and just making sure that it's a comfortable sleep environment. Unplug from technology at least 2 hours before bed. So things like our phones or computers, laptops, even TVs, they emit what's called blue light, which could interfere with our natural circadian rhythm or our natural kind of sleep clock. So we really want to make sure that we're limiting that blue light before bed so it's not interrupting our sleep. What you can do is, if you still want to use, if you're someone who likes to maybe read an e-reader type book before bed, or you want to use your laptop before bed, you can get what's called blue light blocking glasses. So I actually have them on right now. Mine are for more so the day use, but they also have higher quality ones for the evening before bed. So that might be something to look into as well. So relaxation training. So if you tend to be someone who is naturally hyper aroused, like maybe you have a lot of stress going on and you're just really struggling to fall asleep and you can't turn off your brain, one thing you could use is what's called relaxation training. So these are techniques to help you relax and wind down. So things like diaphragmatic breathing, guided imagery, progressive muscle relaxation or meditation. These could all be used to reduce arousal and really promote sleep. And some resources, if you're looking into, if you're wanting to look into some resources, things include Audible, Insight Timer, Headspace, and then there's also some really good audio tracks on the My Health Alberta relaxation website. So you could find some good ones in there as well. Or if you could even search on YouTube, just kind of relaxation. There's a bunch that you should be able to find through there as well. So cognitive reframes for sleep. So this is essentially reframing the way you think about sleep. So it utilizes methods to allow you to really take control of your worries and to reduce the effect of your thoughts on its impact of kind of creating anxiety surrounding your sleep. So it looks at any dysfunctional thought patterns that may be contributing to your sleep-related anxiety. So some examples include, I can't sleep, so a good cognitive reframe would be, I'm working on improving my sleep, and tonight's sleep isn't a reflection of the whole week. So a lot of people kind of look at short-term sleep and say, I've had a few bad nights sleep, so this is going to mean that the rest of the sleep is going to be just as bad. So kind of just looking at your sleep as a whole and remembering that it's not always reflection and each night's sleep is individual. Another one would be, I must get 8 hours of sleep. So you could reframe that by remembering my body's sleep needs are unique to me. I will not be able to function tomorrow. So a reframe would be, I will see how I feel tomorrow. So just because you have a bad night's sleep, maybe it's, I don't know, like 1 o'clock in the morning, you're still tossing and turning. Try not to think, oh, this bad night's sleep is going to make my day, the next day, like poor functioning and I'm not going to be able to function. Instead, just take it as, I'm just going to see how I feel. Maybe you feel a little bit tired, maybe a little bit more exhausted, but you're just going to see and not make that definitive, it's going to be horrible. And then my insomnia will cause health problems. So again, like I said previously, having insomnia will not guarantee that you'll have these health problems. So this is a good approach, just sort of to look at any alternative ways of how you could think your sleep. So if you're thinking negatively and you're taking a negative approach, kind of just taking this cognitive reframe and thinking of more positive ways to view it. So here are some resources. And again, you'll be able to get these slides. Okay. And then since we do have time, I did want to go over a brief relaxation exercise. So I'll stop sharing my screen. And then just 2 resources if anyone's interested. If you're more of a reader, these 2 books, which I'll link it as well, Sink into Sleep, as well as the Insomnia workbook, would be really good kind of resources to use. And I'll just kind of look through the comments here. Okay, so Dorothy says, my sleep presently is a 4, as it is only 2 hours before waking due to pain. Okay. Okay, sleep currently fairly good, but seems to go in cycles. Gets worse last quarter when not doing well, but up to 3 to 4 times. Okay, yeah, and just remembering that it is in cycles, so you'll have some nights where it may not be as great than others. Just kind of remembering that the sleep doesn't reflect your whole kind of quality sleep. So just wanted to
Rochelle's hand is raised, and it's giving me a button to allow her to talk. So Rochelle, I'm going to allow you to talk and see what happens. But you're on mute, so. Rochelle, are you there?
you might be able to unmute her.
Oh, there you go.
Right
I
there.
unmuted me.
Okay.
Can you hear me?
Yes.
I'm sorry, I wasn't paying attention and it was up and I didn't have a question.
Okay. Well, I had a few questions, and so maybe they'll spur some other people's questions. Okay, so I'm just going to mute you back again, Rochelle, and I don't know how to get rid of you. Okay.
Oh, there we go.
So first of all, Courtney, is it true that you age, as you age, you need less sleep?
So it depends. You tend to need less sleep as you age. But some people, again, they still need more. It really kind of depends on the individual, and just kind of remembering on average, like if you're feeling relatively more refreshed with a certain number, that's probably how many hours of sleep you need. And just trying to not be like, I need this X amount number of sleep, and just being kind of like dead set on that number, because it won't always happen.
Right. So it comes back to experimenting with
Yeah.
the window that you talked about, right?
Yeah. Mm-hmm.
Looking at sort of, I guess you'd have to record how long you've slept. A lot of watches, I think, will do that for you, right? Tell you how many hours you've slept and when you woke up.
Yeah. Now, sometimes those watches aren't the most accurate tool. So it's best to kind of just go with the estimate. A lot of people like to keep like a sleep diary, so kind of just keeping track. That could be quite helpful. So kind of just doing that as well.
Okay. Yeah, my problem is, especially if I'm having trouble getting to sleep, I'll never really know when I actually got to sleep, because, you know, I could have, I'm one of these people who will lay there for an hour or two and not get up because I don't want to.
Yeah, it's hard to get out of bed.
Yeah. Okay, well, that's good to know. I'll try and do that more. When you were talking about going to sleep only when sleepy, what about reading in bed? Because that's life, like a tried and true. People have been doing it for generations, I think, reading in bed. And then I feel like if I tried to read in bed somewhere else, just the act of getting up and walking upstairs to the bedroom would wake me up again. Are you saying we still should try and go somewhere else?
So it really depends on who you ask, per se. Some people will say no, definitely don't read in bed. I say if it relaxes you and you don't find it like too kind of hyper arousing, it's fine, but it's sort of limit the amount of time. So if you're reading like a good book, like I wouldn't spend like over an hour kind of getting in it. Maybe just kind of stick with like 20 to 30 minutes before bed.
Yeah, that's fair. Because if you get into a really good book, and sometimes it, like they say, it's hard to put it down.
Yeah, sometimes it'd be hard to put it down. So if that's the case, then maybe just kind of limit the time.
Yeah. Yeah. Okay. Because I always find that reading, because I do it in bed, I know when I'm having trouble keeping my eyes open, that's now it's time I can put my book down. I do. You had talked about the blue light as well. So a lot of tablets and stuff, which is where I think most people do their reading in bed if they're using a tablet or an electronic device. You can set those to change the light.
Yeah, so they have
it's
settings
no
to dim it
longer
down. Yeah.
And so I'm surprised they have blue blockers actually for daytime use, because it's funny, I was just listening to a podcast this morning that was and he's a guy from Stanford, and he was talking about his routine, and he was talking about blue blockers, and said that you know, during the day you actually want the blue light maybe not the unnatural light from the screens and stuff, but the daylight from outside to hit your eyes, because it helps with your alertness and your attentiveness.
Yeah, so I just wear mine, like I'm on my computer all day, so that's why I have mine, because it causes eye strain. But if I go outside and I'm not on a computer, then no, I don't wear it. But yeah.
Oh, okay. So yeah. So do you like them then? Do you think
I do. I feel like it works well for me. I found previously I was getting a lot of headaches related to kind of eye strain. So once I started wearing these blue light blocking glasses, it's really helped me in that. Yeah.
Oh, that's good to know.
Mm-hmm.
So yeah, what the doctor was saying on that podcast was, if you're going to buy because you can buy special glasses that are just for blue blocking. I mean, I think those look like they're prescription. So, but if you're going to wear them, just wear them late at night.
Yeah.
Like if that's the purpose, to help, especially I would think if you had to use the computer.
Yeah, like if there's some that they're different quality, like there's a stronger, if you're looking for blue light blocking glasses for the evening to block out really the blue light to impact your sleep, then I would definitely get like a more kind of stronger pair. These are mainly for just kind of technology, just kind of daytime blockers. So I don't know how much they actually block, but I probably wouldn't recommend these for like actual evening kind of blue light blockers.
Right, you'd want something more meant for nighttime.
Yeah.
To block that stuff. We have a question from Judith, and Judith, I'm not quite sure what the question is, but I'll read it out. What about taking meds before bed, i.e. Maxidex eye drops, which I take 4 times a day, have to take 4 times a day? So I'm not sure what the question is, Judith. Did you want to try and expand on that? Like, should you try and not take them too soon before bed? Was that the question? Anyway, we'll come back to that if she does.
Okay.
So there was a little bit of a contradiction in my mind in some of what you were saying, because we were talking about if you're tossing and turning for more than 30 minutes, then you should get up, which is great, but don't watch the clock. So I said, well, how do you know you've been doing it for 30 minutes?
Yeah, so it's not like an exact, like if you feel like you've been tossing and turning like for a long time, I would just sort of guess if it feels like a long time, then that's sort of indication to go to bed. But obviously you're not going to just sort of start timing yourself, because that'll just make things worse. So
yeah. I noticed you didn't mention anything about like melatonin or valerian or any of those kinds of things. Is there a reason? Are you just not?
So in terms of those, so the clinic I used to work at, we didn't recommend, like we only recommended melatonin for certain situations. We don't recommend everyone takes melatonin. So that's why I sort of didn't bring it up. But if you're interested, I would always discuss that like with your doctor to see if that's the best approach for you.
Right. So was there a reason that you didn't recommend melatonin?
We usually only recommend melatonin if we're in certain situations, like shift workers. Melatonin would be a good use. People, if we're trying to kind of shift their sleep clock, but otherwise it's kind of just talk to your doctor and see if that's a good approach.
Oh, okay. Okay, so we have a question from Ron. See lots of ads these days for cool mattresses and bedding for good sleep. Any comments? Also, any suggestions generally for good mattresses? Also, specifically, the same with pillow. I figure my mattress cools well since the underside of my pillow is always cold, so I flip the pillow as cool helps me sleep. I also finding this microfiber in bedding tends to get hot after a while. Also, does body temp vary quite a bit itself as the night goes along?
Yeah, so as you sleep, your body tends to kind of dip in body temperature, and you tend to sleep better when it's a little bit kind of cooler. So that's why some people like the cooling blankets and sheets, especially if you're menopausal with the hot flashes. It could definitely be beneficial as well. There's no sort of one set like pillow or mattress I recommend, because people like different kind of comfort and comfort levels for that. So it's all about just sort of trying them out and seeing what works for you. Some people like more harder mattress, some people like more soft. It's really individual, so there's not really one particular type.
How about, you know, a lot of people recommend having like the pillow between the knees, and I actually have a specially shaped pillow that's more like a triangle with a little dip in it to put between the knees, and that's supposed to help keep your posture while you're sleeping, I think, in a better position.
I haven't heard much about that. I know a lot of people find that more comfortable. So if it's more comfortable, then I would say that's totally fine. But in terms of posture, I'm not too sure of what the benefits are.
Yeah. So I read a book, and it was more about back pain. It's called 8 Steps to a Pain-Free Back. You can tell I have it just up here. And yeah, the woman is a doctor who studied more about posture, but one of the things was to sleep. If you're having back pain, making sure your spine is elongated by sleeping on either side. I can't sleep on my back. For one, it makes me snore, and for another, my back has a bit of a sway to it, so it's just not, it just gets sore. But anyway, so I'm always sleeping on my side with this pillow between my legs, but I make a point as I'm laying my head down on the pillow to stretch my neck, because I do have some compression and degeneration in my spine, in the lower back and in the neck. And so by doing that, at least I believe, and she sort of seemed to validate it, that if you stretch, you know, the stretch that they always say when you pull your neck up, as I lay down, that's opening up the space coming off the spine so that the nerves can have more room. And hopefully that lowers some back pain. I'm just thinking about Ron's question again here. I don't know if you've heard the ads for the My Pillow, but I've been having a lot of problems with the pillows that I have, because my ears seem to get really hot, and then I seem to be getting a lot of pain in my ear because of it. And so I finally caved just this week and ordered one of those My Pillow ones, and I'll let you know, Ron, if it helps at all. It seems cooler, but yeah, it just seems to get really hot, and it feels like the wax is just pouring. It's gross, but just pouring out of it. It's not, but and then the ear seems to get infected. So it's I think it makes a difference, and you do want it cooler if possible. But my pillows aren't working for me either.
I'd also be aware like the size of the pillow, because I've heard if you have like too big of a pillow, that could also push your head forward as well. So in terms of kind of keeping
you don't want it, well, depending on which way, I guess. You have it leaning either this way or that way, or too far forward, which isn't good. You really want it to be in that perfect postural position if you can, to help the nerves coming off. So I know a lot of our people, like I think it was Dorothy, let me go back up a little bit, was talking about how she only gets 2 hours before she wakes up at night. So I'm sure, Courtney, you don't really want to speak to this, but I do know there's different sleeping pills that you can get from the doctor that are actual medications. And there's the ones that help you get to sleep, and then the ones that help you stay asleep. And you might want to have a chat with your doctor about if one of the ones that helps you stay asleep would maybe help you get the better sleep longer term, because 2 hours of sleep a night simply isn't sufficient. It's not healthy.
And I would also, depending on where you live, you could always ask your doctor if there's a sleep specialist that they could refer you to, because they're usually the experts in what sort of specific medication that you should be taking as well in terms of sleep.
Yeah, that's a good point, right? Yeah. If I was having sleep problems, I would definitely want to go to a sleep specialist or a sleep clinic, because a doctor or GP isn't going to get you a CPAP, for example, if you need it. You have to go to a sleep clinic, and they'll do a whole sleep study with you. Can you talk a little bit about the sleep studies and maybe how that could help people?
Yeah, so there's two different sleep studies. So the one is a basic sort of take-home sleep study. So that's more for sleep apnea. And then there's also a kind of sleep study that's more kind of comprehensive, where you would stay at the clinic overnight in the lab. So unfortunately, those aren't covered under Alberta Health. So sometimes you have to pay out of pocket, and it could be a little bit pricey. But it does sort of gives you a good comprehensive and rules out any sort of underlying kind of medical conditions.
Right. Oh, I know I'm getting a message that I am missing. Most of the night on back, but when on side, I add a small pillow between being airplane flat little one, just above the hip, as per physio dude online, addition to between the knees. So you've got two pillows between your legs? That's interesting. But yeah, the whole comfort position obviously is important, because it's hard to get to sleep if you're not comfortable.
Yeah.
For a lot of our people, though, it really is about, well, in the winter, your feet are ice cold, so you go to bed and they just won't get warm. And it's a kind of cold that you feel right down to the bone. At least it is for me and a lot of people I've talked to. And then for me and a lot of other people, it swings. Oh, small ones on the ribs. It swings once they do start to warm up. If you're fortunate enough that they do warm up, they swing, if you warm them up too fast, to the burning problem, right? And so I can speak to all of that as best as I can. There's all kinds of little tricks you can try if your feet are burning. Obviously, getting up and putting them in cool water. Or for myself, because my symptoms aren't as bad as some of the other people's, I find I can just walk around on cool tiles or the cool floor, and that will help a little bit. I use camphor and menthol ointment and rub that on my feet. And that's basically Vicks Vapor Rub, by the way, but you can, oh, it's right here. Isn't that funny? It's right here. Yeah, this one, medicated ointment. So that, and then if it's a really bad night, I'll add a fan. Now, if you remember, because your nerves, you maybe don't feel that burning as much through the day, but at night, the nerves really kick up, right? And so they're damaged. We know that. And so they're firing randomly in the form of pain or burning. And so you want to kind of distract them. So the menthol, the Vicks Vapor Rub, peppermint oil, cinnamon oil, even some of the capsaicin, even though it's counterintuitive, it gives the nerves something else to think about. And especially if you put the fan on and have the fan blowing on them. I almost think it's better to have it oscillate, because it's changing, as opposed to just blowing constantly on them, because it would send different signals as it's oscillating back and forth to your feet. And then another thing we haven't mentioned, of course, is medical marijuana. A lot of people use medical marijuana to help get to sleep. That's really kind of the only time I ever used it. And it doesn't have to be with THC in it, or the one that's hallucinogenic. It can be CBD oil. And I see Judith is asking about weighted blankets. Have you ever had any experience with weighted blankets, Courtney?
So I personally use a weighted blanket, and I love it. I've found a lot of people do sleep better with a weighted blanket. It's also helpful if you have kind of anxiety as well. It's sort of kind of anxiety kind of limiting, I guess. So it does help with that as well. But it's always worth a kind of shot to try it out. Now there are different weights of the blankets. So I would recommend choosing your weighted blanket based on your individual weight. So it'll kind of give you a recommendation based on what your weight of which one you should go for. But I have one and I do love it. So
Are different weights for different purposes?
it's just based on your own weight. So you shouldn't be using like too heavy of weight if you're like kind of a lighter person, and a heavier person would require a heavier weighted blanket. So just based on your weight.
Okay.
Mm-hmm.
So I have a weighted blanket that I made when my son was young. So it's a small blanket, it's more like a throw, but he was little at the time. And I made it myself. So I sewed all the weights into the blanket, which is great until you think you want to wash the thing.
Yeah.
So does your blanket have, I've seen it where it's a whole series of pockets and you put the weights in the little pockets, or is yours like built in as well?
So mine is built in, but it comes with a cover, so you can wash the cover, but you can't wash the actual blanket. And the thing that I don't like about mine is the weights, there aren't kind of like stuck in them, like they fall through, so they'll usually like clump in one spot, so I have to like shake it out. But yeah, it does come with a cover that you could wash.
Oh, okay.
Mm-hmm.
So there you go. I don't use my weighted blanket very much because I don't have as much trouble getting to sleep, but I do love the way it feels.
Mm-hmm.
And I've heard really good things about weighted blankets and how they do help people sleep or relax or calm down. It really does something to the nervous system. I believe that.
Yeah.
I'm not sure it would help with the burning feet. As a matter of fact, I found mine to be really hot. And so I would get really hot in it. I want to thank Courtney for spending the time to come up with the presentation and take time out of her day today to be with us. It was really appreciated.